world's never-ending quest for perfect vision. If you are nearsighted, hate your glasses, and are sick of your contact lenses, take heart. Dr. Max Gomez is living proof that there's hope.
Well, I think so, Sue. You know, there really must be a lot of people out there who hate their glasses or contacts, judging by the huge number of calls and letters we got after I had my first eye lasered. Well, it's been 6 months. Here's how my first eye is doing and what I did about my other one. As before any eye surgery, the first step is a comprehensive eye exam. There's a check of my prescription, ruling out glaucoma, the thickness and shape of my cornea, and most importantly, a topographic map of my cornea.
That's the irregular shape of the cornea?
Irregular shape of the cornea,
and
meaning...
that's the astigmatism?
That's astigmatism.
The difference is that your left eye was simply nearsighted, and that's all. It's a simpler procedure. In the right eye, you have a mixture of nearsightedness as well as astigmatism.
Now, after I had my first eye lasered, my left eye, I was still wearing a contact lens in my right eye. So I would spend all day opening and closing my eyes, trying to compare the vision between my two eyes. And what I found was that the vision in my left eye at first was a little bit fuzzier, but as the eye healed, it got clearer and clearer until eventually it was better than the eye with my contact lens in it. Now, I still do have to wear reading glasses, especially when I'm trying to read, say, some small print, like in this medical textbook here. But that would have been the case whether or not I had the laser done. The laser procedure and the contact lenses that it's meant to do away with help me focus far away. That's because I'm nearsighted. That works against my focusing up close, like when I'm reading. That kind of problem is just part of getting older. Finally, it's time to quit talking and start lasering. Nurse Donna has been numbing my eye with plenty of anesthetic drops. After putting on a lid lock so I can't blink, Dr. Dello Russo scrapes off the cells covering my cornea. And then the serious part begins. The clicks mean the laser is vaporizing tiny bits of my eye. My better half watches in amazement.
He's remarked many times how nice it is to wake up and open your eyes and be able to see. Of course, that was just out of one eye. Now he'll be able to see out of both eyes.
The excimer laser removes just enough tissue to flatten the front surface of my cornea so that light rays are now focused precisely on the retina at the back of the eye. In about 60 seconds, it's over. You might remember I was hoping for a better golf game after all this. Well, now I really can keep my eye on the ball as it disappears into the woods. You know, the woods to the right or the left, not those ones straight out there. Now, here's the bottom line. In my left eye, I can now see better than 20/20, no problem. My right eye was lasered about 6.5 weeks ago, and I can see about 20/40 or so, which is good enough to drive without lenses, and my vision should continue to improve over the next couple of months. But remember, I'm just one patient. What works for me may not necessarily work for you. Still, the results so far indicate that better than 93% of patients get at least that 20/40 vision. And one more thing, it is not approved by the FDA yet. It is still what's called investigational, but it's probably going to be approved sometime in the next year or two.
You had some discomfort after the first procedure. How about the second one?
Yeah, the first eye hurt a lot. They changed it a little bit. They actually use a soft contact lens as a bandage in the eye, and they give you little drops that include an anti-inflammatory, sort of like ibuprofen in the eye, and that kept the discomfort much, much more tolerable. It was much more comfortable.
Thanks, Max.
You bet.